So, Sonali Dave ji,
Huh.
you've done the spiritual care program with Chinmaya Mission.
Mm-hmm.
What is this chaplaincy course? What is spiritual care all about? Why did the mission start this program?
Okay. So, first, I'll talk to you about the chaplaincy. So, spiritual care, especially in the hospital setting or even anywhere else, it's all about um, bringing God to that person to whom you are giving care, in short. So, we say, like chaplains would say, we are there to bring, God to the person who is vulnerable or facing difficulties. When we introduce ourselves, we say that we are there for emotional and spiritual support. And how your question was about how I got why Chinmaya Mission
Why is
started.
Chinmaya Mission starting this program in the
Right.
first place?
So in US, at least when I started with my first course in CPE or chaplaincy, Hindu spiritual
What
care,
does CPE stand for?
clinical pastoral education.
Clinical Pastoral Education. Okay.
Yeah. So that's mostly in the hospital setting. But spiritual care is either or chaplaincy is, it's anywhere, any organization can have a chapel. So for example, in olden times in the Western world, they had chapel within the palatial area, like castle. A castle would have a chapel. Churches are standalone, whereas chapels are associated with an organization. So in modern world, you have chapels at the airports,
Yeah.
at the hospitals, and even some companies like Christus, where I was working, they had a chapel because it was a Catholic company.
Mm-hmm.
And the person, the minister who does the administration or the spiritual pastoral work at chapel is called a chaplain. So that's where the chaplain word came in. But in the hospital setting, it is not just about Christianity, because there are people, whether you consider staff or patients, they are all of different religions. So chaplaincy, when the CPE started, it was all about providing emotional and spiritual care to the person. And that's why usually in hospital settings you would have all kinds of Christian, Christian denomination, Catholics, plus Hindus. Not so many. We are just beginning,
Mm.
and there will be imams and Jewish rabbis and any other religion. Like they can have a chaplain or a spiritual caregiver in hospital settings. Why Chinmaya Mission started? It's because there was dearth of Hindu chaplains all around. With the Hindu population increasing in US, and universities is one of the big area where chaplaincy, especially Hindu students who are in large numbers in top universities, we needed to provide a setting or a spiritual care for our Hindu students who were probably also either born here or they immigrated from India, and they needed a support system.
So is the course set up to where there's core subjects plus paths of I want to be university chaplain, hospital chaplain, military-based chaplain? How does that course system work?
Right. So the way the coursework is, initially you take introduction to spiritual care. So that's where they teach about like the ethics of spiritual care or chaplaincy per se, and it depends on the teacher. So if the teacher, like the first teacher that we had, she was a chaplain at the Duke University. So she kind of gave us more information about the spiritual care at universities. But the Hindu spiritual care teacher was a CPE certified teacher.
Right.
So he taught us spiritual care from this clinical aspect, so clinical pastoral care.
And is there a specific background someone needs to have to be qualified to be a part of this course and embark on this path?
So if you ask a CPE instructor, he will say no, you don't need. But each of us, especially spiritual caregivers, are informed by our own religion, right? So, and in CPE, when we are doing our verbatims or didactics, we are supposed to quote our scriptures or say how we are informed by our own spirituality in providing care. So in that respect, we need to have some background of our scriptural knowledge.
So how deep does that scriptural knowledge have to go? Is it like full into knowing prakarana granthas and to that extent? Is it more of understanding what the ethos of Hinduism is and understanding specifics of what is dharma and right action? What is end of life care like? What are the specific things we need to know?
Yeah. So we did have a rites and ritual course at CIF. And I will say, because Hinduism is so different, and even within India, different regions have different cultural tradition to the same event, like death or birth or lagna vivaha, all of those, right? But then again, there are some core explanation on why we perform rites and rituals. So, the 16 samskaras. So we learned all that, but I won't say it is mandatory, because you can always have resources available to you and refer the person who has come to you for care to that resource who can provide more detailed information about that. So while as a chaplain, it's good to have high level knowledge about these areas, but I won't say it is mandatory. But at the same time, Vedanta, like Advaita Vedanta and the philosophy of Vedanta, is very important. And I will tell you why. Because especially from the clinical pastoral education perspective, there are certain objectives you have to meet in order to certify or like pass the units. And when you look at those objectives, it kind of makes sense, or it is very easy when you have the Vedanta. We have, what do you say, like the knowledge of Advaita Vedanta. You will see why it makes sense. And I think it's just easier. So for us, it is a second nature.
Right.
But they have to keep those objectives and outcomes in the syllabus in order for maybe other faiths to meet those requirement of being non-judgmental, understanding your bias. So there are all these different outcomes, like how you understand, implicit bias or self-care.
Yes.
And many other, like how you are informed, how your own narrative history informs your chaplaincy, the trauma we may have faced. So in order because clinical pastoral education is not just understanding your own self, but also understanding the person whom you are giving care.
So in this education, what was it, those few points that really stuck with you that you never even considered before taking this kind of a course? That you come in with some idea of, this is what I want to do, this is the mindset I have to have. What was it that this course gave you that completely caught you off guard, saying, I never thought about that. Wow, this is just so important.
If I have to pick like couple of things, I would say self-healing, how critical it is for us in order to help others. And this is not a secret. Like our Swamijis tell us all the time, right? That why we do japa, it's for self-healing. Unless you have that strength within you, you cannot really serve the society.
Right.
But here it just takes, it kind of, even though it is not surprise, you kind of see how it plays out when you are giving spiritual care in the hospital setting. Like your hesitations, the way you were raised, for example.
So your primary work has been in the hospitals then?
Predominantly, yes.
So describe the first time you go in there to do this, where it's not a training, you're actually out there providing this care. What's going through your head when you're walking in there?
So I felt very peaceful, actually.
Mm-hmm.
And I owe it to the training that I got in CIF.
Mm-hmm.
I think CIF is must have for any Hindu spiritual caregiver or somebody aspiring to be a chaplaincy, whether they want to go in the university setting or hospital setting. I think the CIF course, especially the Hindu spiritual care course, was instrumental in training me to provide spiritual care to others in a very non-judgmental way. So the astounding thing for me was that it was automatic for me, no matter how um, how against my dharma, like, if I were to objectively analyze using intellect, right, a patient's life, you would be all judgmental.
Right.
Like we would say, oh, this person may have done like this, so they're suffering. But no, that never even occurs to you. And that was most astounding, surprising, and very pleasant. And it kind of gives you so much peace when you are in that non-judgmental form.
Gurudev would always say, when dealing with others, use your heart. When dealing with
Exactly.
yourself, ruthlessly use your head.
Right.
And we have that backwards so often. We want to be
Yeah.
emotional with ourselves. We get so objective. Giving advice to others is so easy to do.
So easy,
it's
right?
wonderfully easy
Yeah.
to do. But then, okay, this hospital setting, you typically deal with, I imagine, end of care, end of life when they need that peace. What are the other kinds of situations broadly?
Oh, it ranges from anywhere. So there can be, so I worked predominantly in children's hospital. So there would be kids with, there would be kids with physical ailments, of course, like type 1 diabetes. Suddenly they will have symptoms, or eating disorders, depression, like mental disorders, violence, like self-harm, suicide attempts, that type of folks.
In children
kids.
even, not just teens.
Children. This is children. Yeah.
Wow.
Not I've had 10-year-old inflicting self-harm, which is sad, but it happens.
Then you have to go in and make a connection to help. So often we find, with a friend even, only after years of knowing them can you get through to them and they have that trust. How, as a patient, do they trust someone just coming in to the hospital to see them and provide this care? How do you build that trust so quickly?
Right. So for those, like for the eating disorder units and all, they have weekly group sessions. But if there is other conditions, physical conditions, then they are on the ward in the hospital. And I think that's where the training comes in, right? Because you go in, you introduce yourself as a spiritual caregiver, chaplain. I'm Chaplain Sonali, and I'm here to provide emotional and spiritual support.
So you don't go in with, I'm the Hindu chaplain, Sonali.
No.
Okay, why is that?
Because it does not matter. I am there to serve all patients, right? And it is not that I'm going there to preach my scriptures. I'm there for empathic listening and providing that pastoral presence.
So empathic listening is a technical term right there.
Right.
What does it entail?
Empathic listening would be to listen through not only your eyes, ears, to listen not only through your ears, but eyes, all the expressions, what is happening in the room, and being fully present. Because, and listening to what the person is saying, and also observing your own thoughts, because most of the time there will be intersection of that person's story with your own life story. It will remind you of something. So you then observe your own thoughts and feelings, and that way you connect. So it is that connection in that emotion is empathic listening. So when a person is suffering, you suffer yourself, and that's how you connect. and you understand, and then you enable the person to open up to you.
And if you have a show of emotion,
Mhm.
cry with them, grieve with
Yep.
them, is that encouraged? Is it seen as it's natural? What's the standpoint on that from pastoral care?
So it is natural. And when you say empathy, you have to feel that empathy, right? So it has to be genuine. It
Right.
cannot be a show or an act.
Yeah.
Um, it is not frowned upon, but it shouldn't be that you are breaking down in front of the patient. Like, you don't want to traumatize the patient by breaking down in front. So you definitely need a lot of sadhana on your own to be able to be witness to your pain as well as the pain of the other person.
So do you see a direct correlation between sadhanas that are prescribed and how they help make you that witness and not getting embroiled in what's going on?
Oh,
Like, what are those
absolutely.
direct links that you've found?
So we are going to go deep into Advaita, but you know how in our Puranas or histories, it says, like, Shankar Bhagwan, Dakshinamurti, he just sat there, and I mean his disciples sat in front of him,
Mauna Vyakya, there's no
right?
speaking
And
even
they got
going
the
on.
knowledge, right?
Mhm.
So that same concept, okay, is what you have to develop through your own sadhana and spiritual practice, that just your presence enables that person to heal. You bring God to that person. So basically, when you are non-judgmental, when you are not caught up in your thoughts, your mind is still, right? You become the instrument of God. And when you become instrument of God, then you are not different from that person. And that's where the connection happens. This is actually science. Only Hinduism, Advaita, can actually explain what happens. Most of the chaplains, they do it without knowing. It happens because they are in that empathic listening mode. But why it happens is only explained through Advaita, Vedanta, or our scriptures. So that concept is, and this is my belief. Like, if you talk to a CP instructor, I don't think he will say that you have to, like, do sadhana every day. Like, they may not say that. But I have experienced that, how my own mind, the calmness of my mind, influences my interactions with patient. So this is again your personal, seeking and sadhana that will play into, and you have to have that level of introspection and kind of, we have a way of learning called action, reflection, new action, right? So you have to do that internally as well as when you do the seminars with other peers, is what I would say.
When you see a child who is going through a terminal illness, there's no way to rationally explain what it is. And sometimes that leads to a lack of faith in our own religion, in what it says, that there is a Bhagavan that is looking out for me, that has my best intentions in mind and looking out for everyone. Are there mechanisms and ways to deal with that lack of faith if it dips?
Right, right. Absolutely. So that's called grieving.
Hmm.
So we have to enable, so chaplains also have to enable grieving. That's the main goal. Actually, the way you bring God to the person who is in the hospital is by allowing them to grieve or enabling them to grieve and lament. Because when you grieve, you that healing occurs because of that dynamics that I just explained, right? Because, and in that case, I feel the firmness in the chaplain's faith has to be there.
Right.
I mean, there we can grieve with the family. We understand what they're going through, but I don't feel that a chaplain faith would shake. But yes, that person's faith can shake, and that time we have to be understanding that if I were you, then yes, even I would question God at this point, and we have to enable and allow that. to happen, because that is part of healing.
Mm-hmm. And so have you predominantly dealt with patients who are Hindu and or Indian for the most part in your work?
Actually, no, but I have worked with a lot of Indian patients as well, but not predominantly. I worked in Plano Hospital here at Children's, so obviously I would see Hindu patients of from time to time. So I have met, and I would, and there is a different dynamics, because that's where my social uh, religious background comes in play,
Right.
and I can utilize that
Mm-hmm.
in providing care. Um, but there are other times when I'm speaking to, like 80% of the time, I'm speaking to either Christian um, of various denomination. And at that time, the CPE process and my own sadhana and like that kind of enables me to have this session, um, which is called ministry
Mm-hmm.
in the language of CPE.
Mm-hmm.
It unfolds based on that, empathic listening presence, and then ending with a general prayer to Almighty God.
Have you seen that our Hindu community has needs that are maybe different from the general population or specific to Hindus? You've seen a rise alarmingly of one kind of help that they need? What's the trends you've seen?
Um, yes, I would say that especially young folks, right? We have seen. I cannot talk a lot, but we have seen all kinds of patients, cancer patients, eating disorder patients of Hindu origin.
Mm-hmm.
So there is definitely need for chaplaincy or chaplains, Hindu chaplains, because you can connect differently with Hindu patient. It's just because it is the the group sessions. I think we do have one Hindu chaplain now. Now my unit is done, but I know
Mm-hmm.
we have one Hindu chaplain who conducts group session with the eating disorder unit, which is good, because the Christian chaplain would do the ministry, do the chapel service, right, where they read their scriptures and then they discuss that. Now, we have that here. We do that here at Chinmaya Mission,
Right.
but not necessarily at the hospital,
Right.
right? So, I think there is a need for that, but um, the difference would be, one thing is that most of the Hindus, like many of them, would be afraid that if it is a non-Hindu chaplain,
Mm-hmm.
they are afraid that these guys are going to like try to convert, and sometimes rightly
And
so.
I've seen that at the hospital.
Right.
Recently, this was when
Yeah.
I first came back as a brahmachari.
Yeah.
One of our mission members had lost a family member.
Mhm.
And we were there, and after the person had expired, instantly out of nowhere, there was a chaplain, I think part of the hospital system, wouldn't even let the family grieve, was trying to push these pamphlets or saying in times of need. I had to go up there and say, hey, I am the spiritual provider for this family. Please let us be. Like 3-4 times I had to repeat it. And
Right.
you're at your most vulnerable point then. Having
Right.
just lost a family member, and to be thrust this on in a most aggressive way, just really broke my heart to see that.
Right. So that's one, and it has happened to me when I was volunteering. So before I actually started the unit, I was volunteering, and but this is against the CPE ethics. Just, you are not supposed to convert, promote. Actually, we are told, I cannot go and like announce somebody, I'm a Hindu chaplain. No, I'm a chaplain. I'm Chaplain Sonali. I'm here for spiritual, emotional support. How can I help you? Do you have any concerns? And what brought you here? I kind of engage them in conversation, and then I understand what is their pain point, and then like push them to open up and grieve about that painful thing that is going on. So that's the process, right? There is no religion, nothing. But in spite of that, it does happen. That's against the ethics of CPE. Like it's morally wrong, ethically wrong.
Right.
They can be reported. And I've had that happen when I was volunteering as a chaplain at hospital before I started full time. My CP unit. One Christian chaplain who I was shadowing, she spoke down about Hinduism in front of a patient.
And you.
So she said, "Oh, I am Christian." So that child, the patient, was very, very sweet, and he had questions about certain scriptural aspects of Christianity or Catholicism, whatever his religion was. And she said, "I am Christian. I don't do any idol worship or anything." She should not talk like that when she knew I was a Hindu chaplain. So that has happened.
What biases as a Hindu do you have to put aside when you're working with someone without a Hindu background?
To be very honest with you, I can only speak for myself. I felt absolutely no bias against anybody probably because of the way I was trained at CIF, that I literally, my heart went out whether the child was, Muslim or Hindu or Christian, Baptist. In fact, even if somebody rejected me, I still never had any ill feeling because we are trained to
How
accept.
did those rejections happen? What were some examples?
There were very few, to be honest with you. And we'll talk about one later. So there was one Buddhist rejection, and she said, "I'm Buddhist and no, I don't need." And I was like, "It doesn't matter what you are." But I said, "Okay, thank you." And you leave the room when that happens. So actually, I can just count rejection on my fingertips, right? There were 2.
So people are receptive to it for the most part.
Very receptive. Very receptive. And that's the beautiful part of it.
Yeah.
And then
is it that they're holding on to anything at that time when they're in need? That, okay, maybe this will work even if I'm not familiar with it? Or what's the reasoning for being so accepting?
So there are multiple things. So the other rejection was because of a Baptist person, but it was not an outright rejection. I talked to him for 45 minutes, and it's still, and we had a wonderful conversation. He had questions about, third eye of Shiva and things like that. And he politely refused a prayer at the end of it. Yeah. But he said, "Oh, it was beneficial to talk to you," because he was speaking about all his responsibilities and stuff like this. Was the patient's brother.
Okay.
Patient was sleeping. But yeah, so sorry, your question was about
just that how is
whether why are they just open because they are so vulnerable?
they're so
Not
vulnerable.
necessarily.
Okay.
Not necessarily. So many times the Christian community knows what is the purpose of chaplain. And I always go with the bindi and my rudraksha, bead and navagraha mala, whatever I wear, Mangal Sutra, right? So it's not like
that you wear because you don't say outright you're a Hindu chaplain, but they're fine with you outward appearance completely Hindu in that way is okay?
It has been okay. I can only tell from experience.
Okay.
They do not encourage or discourage us to wear our symbols, like the instructor. The educator will not. I was very blessed to have a wonderful educator, CP educator. Sometimes they will talk about their family or like events. So sometimes it ends up as a social visit. And then sometimes it will be a grieving session for them because of their life being very difficult. And I had a young mother, teenage mom, right? She was so lost and overwhelmed. She didn't care whether I was Hindu or Christian. And she wanted to talk. And she said, "I believe in everything. Like, I believe in all religion. There is, so I've met some beautiful people. I don't know whether it's the hospital that does that to them." So even the rejections were like 1 or 2 rejections were not harsh or like insulting, if I can say that.
So are there other chaplains that you share things with as like support system that it takes one to know one?
Yeah.
So do you have a network?
So all the peers are definitely my support system while I'm doing CPE. So there is actually an outcome of collaboration and feedback. Like we have to prove that we are meeting this outcome where we have examples of collaborating with, others and feedback from others. Um, but with my CIF cohort, it's the bond that will never break. Anytime, even if I'm going through personal crisis, I will pick up. When Anand was sick, everybody said prayers. Like they called me, what is his gotra? What is his, nakshatra? Pretty much my whole class, whoever does the prayers, like they all reached out to me and they asked me and they did prayers for Anand. And in Hinduism, that itself is a spiritual care, right? But in hospital, you can't like go there and do a, havan for somebody, or you can't do puja for somebody there. So this is a way of providing spiritual care. But in Hinduism, there are many other ways of spiritual care. Like everything that Chinmaya Mission does is, in a way, a spiritual care. This is just more one-on-one, and it's more about the grieving method. Just because life gets in the way in our sadhana, and like not most of the gruhastha, they don't have time to go to Sandipani sadhanalaya and spend couple of years just doing that. And even if we had an opportunity to do that, there will be times where we just want to talk to somebody.
So then what is the timeline of your engagement with the patient? You go and see them in the hospital. Once they're discharged, if they want more spiritual care or some guidance, are you encouraged to engage with them even after their tenure at the hospital?
No, that's where the spiritual boundary, like the boundaries and all, like relational boundaries and all comes into play.
Even if they've built a good rapport with you and really connect with you?
Nah. Like, for example, if there is a death in the hospital, then as part of that, you can reach out to the person even after everything has been done in the hospital, because especially at children's hospital, we are responsible for everything, like after death, all the paperwork, autopsy, like declaration, like whether they want to do autopsy, not do, whether they are okay with using the body for training, not using, all those things, like donation of all that paperwork.
So you walk the family through all
we
those
walk
things.
them all through.
It's so difficult to have to make those decisions when you've like lost your kid.
Exactly.
And imagine having to go through all of that at that time.
And give them care
Yeah.
while we tell them, but we don't rush them to make those decisions. Like funeral home decisions, all those have to be made. But it is not like they have been given time. So we kind of continue to provide care. And I know certain exceptions. And after that, we also write them like a card. That was the policy of children's. So you would keep, send them a card even afterwards. And then in some cases, you can tell them that they have your services. But that would be just outside of hospital. Yeah.
So you mentioned early on there's a dearth of Hindus in chaplaincy. You look at other pockets of religions that are there in our city in DFW, Judaism, Islam, adherents to that religion are comparable to our population as Hindus. You seem to find that they have many chaplains of those religions. Why are there fewer number of Hindu chaplains?
I think it goes back to like the 1990s when the Jewish started, their program, so we are at that stage. I think it's just not knowing.
Okay.
It's all about not knowing. And most of the university chaplains were also not like trained. And we have probably like 1 or 2 CP in the whole of US, certified CP. Now we probably have like 3 or 3 or 4.
Okay.
When I started, there was like 1 or 2 people who are CPE certified, ACPE certified. The university chaplains don't have to be ACPE certified, but the clinical ones do. And we probably now have like 4 or maybe, I think 4. Based on the recent NACA conference that I attended, I think we have 4 or 5 certified chaplains. So that's like all over US. And we have big pockets of, Hindu population in major cities, right? So we definitely need, and actually in the hospital settings we need, because hospital chaplains are not just for patients, they are also for staff care.
Oh, have you done that also?
Yes.
What's that like?
So we do so staff care is slightly different. Most of the time we do staff care in ED, emergency department, because they are the ones who are
Most
bearing the brunt.
Mm.
So we do there. So we kind of report to trauma, and then it's more very like westernized. I'm wanting to use this term because they do care card. So they'll take coffee, and then the nurses will talk. You just talk to the nurses. If they want to share something, they will share. They are always encouraged to make one-on-one appointment, and that's where you build the rapport with the staff. So when you get to know the nurses and the doctors, then they will reach out to you if they need one-on-one. Otherwise, you do like care cards and things like that. But we also started, like me and Sharda ji, who's my cohort at the CIF in the first 2 courses. We started the Hindu prayer meetings, monthly prayer meetings at Children's. So that is specifically for staff, so Hindu staff, so they can come and visit. So we kind of started that, and we are hoping it will flourish even after we have left the hospital, because we do have a Hindu chaplain there, Binduji. She's a certified chaplain, and she got equivalency for the master's level program. So
Wow.
you have to have a master's in divinity for the certification. So she was able to get the equivalency for it. So hopefully she's continuing.
So she's one of those 3 or 4 that you were talking
Yeah.
about that are super qualified.
Correct,
Okay.
right. We are building the network. So we were the first, like my cohort was the first one who attended those CIF courses. And I think after that, there is a second and probably a third batch now. So I think this time NACA conference had a good turnout.
National Association of
Hindu National Association of North American Hindu Association of Chaplains or something like that.
Oh,
NACA.
wow. Okay.
Chaplains.
Nice.
Yeah.
And with the medical industry rife with so many Hindu physicians and Hindu nurses, those in the industry, is that going to make a difference going forward in terms of Hindu spiritual care? Having staff that's so, in many hospitals, quite Hindu in that way.
Yeah, absolutely. And many hospitals are looking for diversity in their chaplains. I had quite a few interviews, and then I did get an offer from Baylor Scott and White in Dallas for residency program. God willing, we will do it sometime. I mean, it's supposed to start from fall, and I've done the application, but let's see what happens. God willing, we will know whether I'm able to do it now or take a deferment. Yeah.
So if there are listeners to the podcast who they can't really go into this line because of time constraints or other things, but they want to support what you're doing with spiritual care and what Hindu chaplains are doing, how can the rest of us really help out?
People are helping others, right? When you teach at Bal Vihar, when young members teach at Bal Vihar, they are in one way providing spiritual care. But at the same time, I would say that if they want to learn the technique of empathic listening and that kind, we don't have to do, like, I am already certified Hindu chaplain from CIF, right? That certification is there. and 24 credit hours for the APC certification. Like, but it is not necessary for you to have all the units. Like, you need 4 units plus Masters in Divinity to be a ACPE certified clinical pastoral chaplain. So to get a paid job at the hospital. So if you want a paid job at the hospital, then you definitely need to go through CPE. At least that's how it is here, unless big Hindu organizations like Buddhist organizations, they don't have to go through ACPE certification. They are recognized as a Buddhist chaplains and they can get paid position.
So if it's a paid position at a hospital, does it earn enough to where you don't need some other career to supplement your income? Can this be a full-time thing that you jump into?
It can be a full-time thing. It
Okay.
can be a full-time thing.
Where you're not struggling to make ends meet based on pursuing your passion.
So it will never compare to engineering
Right.
or anything,
Right.
right? But I think they get paid, like a staff chaplain would get paid 60 to 90K.
Okay.
60K would be probably starting salary. As a resident, you get paid 43K.
Right.
Yeah. Resident chaplain.
Mm.
So I think for young people, it's easy. Like, I'm so old, right? And it was a struggle for me to hold a full-time job because I couldn't quit my job and do extended CPE, which means I work weekends. I work weekends, also complete the homeworks, which is the verbatims, and do the seminar on Monday. So it took a toll on me. It is a lot. I cannot... for old people, it's not advisable. Like, it's better to do when you are retired because chaplaincy has no age limit.
Right.
You can go and listen and talk to a patient even if you are 80-year-old because it's all about, your presence. So that way it doesn't matter. But for young people who has little more energy,
Right.
I would recommend for them to do at least couple of courses with CIF, if not full. I did everything. So I did rites and rituals, Bhagavad Gita and Mahabharata as the informing scriptures for chaplaincy, and also Indian psychology. So that included like yoga psychology, Advaita, Sankhya.
Psychology or philosophy?
Psychology.
Psychology, okay.
Psychology by Dr. Patni.
Okay.
Yeah. So that was really beautiful course.
What was it like? Yeah.
It was very nice because it was like comparison of Western psychology. Like, that one table impressed me so much because in Indian psychology, the main difference is the person and the patient. Like, both the one who is treating, he is part of the treatment according to Hindu psychology. Like, it is not just that okay, this person's environment is like this, so he has to change these behaviors and he's treated. It's not like that, right? Because who's giving the care is also important. The same example, where the guru can impart knowledge just by his presence. So the psychologist is also part of the treatment, like who's providing the care.
Matters a lot.
It matters a lot.
As we say, if it's a sattvic mindset,
Right.
there is vestige of that in the receiver, whether it's dhanam or any kind of care.
Correct.
So that really makes sense. Now, Bhagavad Gita, it's easy to understand why that was taken as a relevant scripture. What was it from Mahabharata that you gained in your work?
There were a lot of incidents, like Kunti Mata's grief and struggles. All those were weaved into how it informs us in spiritual care.
In Mahatmya of Srimad Bhagavatam,
Right.
it's where Parikshit's entire everything goes on. And so there at the end of Mahabharata, Kunti Devi thanks Bhagavan Krishna, saying, thank you for all the hardship you gave me because it made me remember you. And you think about her hardship, having to let go of Karna in the beginning, exile with her children, having to look out for their lives. This is a queen that's going through losing her husband, of course, all of this, seeing many of her relatives die,
Right.
the discord, and her reaction is, it made me remember you because we
Y-
were in times of hardship.
Right,
Right.
right. And that's the healthy way of looking at pain and suffering to heal from it,
Because what
right?
we find is, I don't know, I struggle with conveying this to people in my work as well, where looking at Purana Itihasa as an inspiration to use in your own life.
Mm-hmm.
These are venerated stories, but at the end of the day, we either see them as a myth, which is wrong, it's our history, or we see it as this is meant as a learning tool for children, not for me as an adult. But we see how much of that is relevant to us adults. We need to really imbibe what that knowledge is.
No, absolutely. Um, and if you see all lot of stories like Pauranic stories, even like Vaibhav Lakshmi's story, it comes to my mind.
Tell us
It
about it. Tell us the story.
So like Vaibhav Lakshmi's story is like it starts with this family, the woman whose husband has like lost job. He's not doing well in his business, and he's become like, and it talks about somehow because of his past karmas, he's becoming like this bad person, and he's playing gambling and drinking alcohol and beating her up and stuff like that. And this lady is grieving, like sad, and one day someone knocks at her door, and she's like praying like, God, please help me. And then someone knocks at the door, and it is an old lady. And because she had this samskara, sanatana samskara, she invites the old lady and offers her water. And like she's embarrassed because there is nothing in the house to offer. So she said, I'm sorry, but like I don't have a good place for you to sit, mother. But here is a glass of water. And then mother says, I see you are in pain. Tell me about your story. And she said, my husband was very nice before, blah, blah, blah. And then but somehow he has, become gone into bad company, and she's grieving. And that's classic spiritual care. Like, that's what we do as chaplains. We listen. There, Bhagwan, Mata Lakshmi is herself is listening to the lamenting of this woman, right? And after, then Mataji gives her, like, you do this vrata, and things will get better. Like, do it on the first Friday. And she describes the vrata, that this is the whole katha of Vaibhav Lakshmi. So she says, and then after the old lady leaves, suddenly the that woman, she feels like peaceful. So just speaking about her agony and pain and suffering to the other old lady, at that time she didn't know that this was Mataji,
She's a
right?
stranger, if anything.
It's a stranger. But then if we look at Advaita, it is Bhagwan who is in everywhere, everything, right? So I kind of remembered this story a lot when we would do our like reflections, and that even all the stories, even Santoshi Ma stories, like there is so much pain and suffering, but then it is Ishvara Shakti that heals, right? Whenever the protagonist comes in contact with Bhagwan or a messenger of God or Bhagwan in another Swarupa, the healing occurs.
Right.
So chaplaincy is all about bringing that divinity to others so the healing occurs. But the process is always about, the chaplaincy process is about sharing your painful experiences. And if the chaplain is trained right, the healing can occur.
Any kind of good health, medicine, anything associated with that is nothing but that divinity. Samudra Mathanam, the story that we find, Dhanvantari Bhagavan is what comes out.
Right.
Out of all the goodies that come the night about everything, Dhanvantari Bhagavan. So that's the very essence of goodness of health, mental, physical, whatever it is,
Right.
divine, nothing but that.
Absolutely. Yeah.
Now, you mentioned that even teaching Bal Vihar is a form of spiritual care. You've taught Bal Vihar for almost 2 decades now.
Yeah.
What is it that you've seen has changed? How do we have to change with the times in terms of how we relate to kids, especially teens, which you've been teaching high school for the most part?
So, first of all, we have to get the kids to talk. I think that's very important. It should be not just giving, giving, giving. Of course, some of the formal training has to be there, but it has to be more interactive and ability of for kids to share their thoughts and feelings. And I think as Advaitins, we kind of understand at an intellectual level that all this is occurring in mind, so not pay attention to our pain and suffering, right?
Mm-hmm.
Now I'm not saying it is wrong to think of it that way, because it is true to some extent. But when we are not completely dissociated from our ego yet, our ego is not dissolved, right? Then that could sometimes lead to suppression of feelings and emotions. And that may manifest differently when they go out of Bal Vihar. This is my personal thought.
We go on with that line of thinking that we have to elicit understanding from them and their feedback and what their thoughts are. In a class of 20 kids, especially in high school, you ask, okay, what do you think about this? You ask something. Not a single person says anything.
Right.
It's fear of, and I went through this, if I actually try in the Bal Vihar class and I contribute to the conversation, I'm seen as a nerd or someone that's weird for taking it seriously. The kids who take Bal Vihar seriously are kind of ostracized by their peers, and I thought that was a thing that only I went through growing up.
No.
Kids are telling me it happens now. So when it's the teachers try to think of interesting questions or ways of reaching out, there's just this lack of reciprocation by the kids. How do we make that interactive?
This is a very good question, and I don't know if it can work with really small kids, but maybe middle school and up, when they have little bit of maturity. I think first is fostering non-judgmentalism among kids, among the peers, right? That's critical, because only when they are confirmed that nobody is going to judge them here, they are going to share. And they are going to feel confident to share.
Then what are those ways where even when the individual instructor is not judging, it can still come across as that? I've seen that happen as well with certain body language or, how we respond to something. Like an instance was if a kid shares something that's happened, school is really tough for them, they're facing a lot of pressure. And if the teacher says something like, don't worry, everything will be fine, the teacher can see that as being reassuring. Some kids have taken it that way of, they're dismissing what my pain is, what I'm going through. There's so many of these misfirings and miscommunications going on. How do we account for that? Is there a training we can do for our teachers?
I think we should definitely, training. Like when somebody is saying that, you don't know whether it's going to be okay for them. That's the first thing, right?
But I still want to provide that reassurance for my kid.
So it's listening, just listening.
Okay.
Oh, that must be, this is classic, right? Like you reiterate, you kind of understand. And what does that remind you of your own life story? It's kind of like a spiritual care training, right? And I've used that since I was after I finished I taught for 6 months, I think, while I was doing my coursework. And I've used that.
And you saw it change the texture of your teaching completely?
Yeah. Absolutely. Yeah.
Then when it's okay, you connect with them on a personal level because that's something you've been through as well. How do you not let that dominate the teaching or conversation? Where when they say, okay, I'm going through this, I went through it too, and you give your personal thing.
You don't give your personal thing.
Okay.
You don't share that.
That's just something for you.
It should not be about, it's just for you to reflect.
Then how do you express that without expressing it then? that I also connect with you on this level.
Must be hard.
Okay.
That's it.
Okay.
Must be hard for you. And we can, you know how we do the icebreaker
Yeah.
in the first class?
Yeah.
Instead of, we can do that, like keep 5 minutes for everybody to check in, share whatever. So, I mean, we do that for CP seminars, right? We check in, we could do that. We check in, everybody says what they did last week, like anything they want to share. It doesn't have to be like a whole 10-minute spiel, but they can speak for 2 minutes, like if anything that happened last week that they want to share. So that's one way. So we go around and, you know, everybody shares something. Then second thing we can do is, if you want to have that healing session, then obviously they have to talk about their feelings, right? And we have different modalities for kids and adults. So we have something called holy listening stones, which has diagram, like some pictures on it, and the kid would pick one stone. They will explain why they picked that.
What are some of the sample pictures or things?
A sun,
Okay.
a smiley face, or a smiley face with like up and down line for lips.
Mm-hmm.
So then arrow, all kinds,
Okay.
broken heart.
Mm.
Yeah. Yeah, there are about 19 such pictures.
Holy listening stones.
Holy listening stones.
Okay. So then they pick up a stone that they're connecting with at the
Yeah,
moment.
and they talk to that. So that's how kids, because if you ask kids, how do you feel about this? They will not be able to say that, right?
I saw a parenting thing once where it's called halted S is the method, where kids throw tantrums for many reasons. Okay. It's not just that they're upset. What breaks the camel's back is not getting that toy or parent saying something, but it's hungry, angry, lonely, tired, embarrassed, and there's a few more. But it's going through that checklist with the kid. It could be one of these. And for a kid, usually it's hungry. You're cranky from that. Could be that. So these are connections where it may not be that one emotion, but you go deeper. You find that it's something else that's triggering what the outer expression is.
Right. So we could do that. Then, of course, there is poetic medicine.
Okay. Poetic medicine. That's another modality.
Another modality.
How does that work?
So poetic medicine is, we read a poem, and we can pick the poem based on the general audience, right? Yeah. We can pick a poem, and it's mostly about like thoughts and feelings about human beings, right? Those type of poems. So you pick a poem, you read. It can be any poem for that matter. You read the poem, and then you go around the table and you ask each person to like speak out the phrases or the words that stood out for them. So you do that in a circle, like till, you know, everybody, like it doesn't have to be just one word. You can go multiple times. So you do that, and then you request them to write a poem on the word they pick or a phrase they picked as a title of that poem. And this is one of the best way to heal and to be in touch with your inner self. Like integrating the head and the heart is what we say. So this really helps with all ages, adults through kids.
And there's age-appropriate poems that they can connect with.
Oh, yeah.
Nice.
Yeah. Then there is godly play, which is a modality. Godly play, which is a modality that we use at children's. Although I haven't got trained in it, but I have seen one demonstration of it, which was pretty good. And so there would be props, and then like you make up your own story with that prop. You make up a story. So the prop was like a desert land with a well and broken pieces of string. And the person who was conducting the godly play, she said, one man came and, connected all the strings and then got the bucket of water and drank it.
Mm.
And then he left the bucket of water with the string there for other travelers to be able to avail of the water.
Mm.
Um, so that is one story. And the other one was he again put it, disconnected all the string pieces and left. And what are your thoughts? Which one do you want to pick? And what is your thoughts? So some people will say, we pick, and what does that mean to you? What does this story mean to you? So obviously it was about spirituality and for me and or religion.
Mm.
And I said I would pick the second one where he puts the strings back in pieces because another person can come and create his own, different way
Right.
of connecting to the water, which quench his thirst,
Mm-hmm.
meaning spiritual thirst.
So looking at the same image, but finding different angles
Different
of
angles,
interpretation.
different interpretation. So
Very
this
nice.
is another way of, spiritual care,
Now,
like
these
godly care.
modalities are all meant for furthering communication, getting more comfortable in expressing more honestly or truthfully. Not that they're lying, but to get deeper that way.
To get deeper.
Now, language is also a barrier in this because for several people that are Hindu or Indian, English may be a second or even third language. You want to express these things in the most honest way possible that you're comfortable with. Are there services that are provided where Hindi, Gujarati, Telugu, Tamil, do they offer pastoral care in these different languages?
Yeah.
Have you been doing that?
I've been, and it was a very pleasant experience for me to be able to speak in Gujarati and Marathi. Although my Marathi is pretty broken, but I did go into this room.
Your husband is Marathi, but it's still broken?
We speak in Hindi. So I have spoken in Hindi.
Yeah.
I have spoken in Hindi with a family from Pakistan as well.
Wow.
Because Urdu,
Is
Hindi are
close.
similar, right? But this Marathi family, initially they didn't even know what chaplain is, right? So when I entered the room and I said, I'm chaplain, they were like, okay, we don't need anything. I said, and that is where the chaplain authority comes in, that you linger. You don't say, okay, go by.
So they encouraged you to linger.
We have to linger.
Okay.
Yes. Because
How do you linger without seeming annoying? How do you do that?
Bhagwan does it. Seriously.
Yeah.
Yeah. I've lingered so many times, and for most time it has been amazing. For me, what unfolds is magical. It's a miracle of God. I'm not the one who's doing anything there.
So as you lingered then, the language came up at that time?
So I lingered. No, I knew because they were in their last name, from the last name. I get patient roster, so
Right.
I knew. So I said, I saw that you're Marathi, and then I engaged with the child in Marathi. Kasa hai tu? And the child's face lit up because he was like 2-year-old, and at that age, the kids are usually talked to in mother tongue, right? My kids knew both Marathi and Gujarati when they were 2-year-olds.
But then
बाद में school जाने के बाद they lost it.
it happens.
Yeah. So the kid's face lit up, and then I kind of, talked to the child more, and then talked to the parents. And at the end of it, I told them what chaplaincy is about. And all the while, I was doing my thing about, observing my thoughts and feelings. Or fear. By the end of it, they said, it was so nice to talk to you. Thank you so much for stopping. Like complete change from that hesitancy to complete acceptance. And after a few days, I had a meeting with my instructor after lunch. So after seminar, there was lunch time, like seminars get over at noon. So I went to the cafeteria because the instructor and all were having lunch. So I went there, and this family was there for a follow-up. And she saw me climbing down the stairs, and she got up from the table and like came and greeted me, gave me a hug, and all this my instructor was seeing. And I was like, she said, I know you see a lot of patients, so you may not remember me, but I know you, like, you came and visited us. It was so nice and heartwarming. I mean, that is just God's grace and blessings on me to make me feel, that good.
Because in our culture, language has such a connection like that, right?
Right.
It's a specific subset that makes a
Yeah.
difference. Now, switching gears, your husband went through a
Mhm.
pretty hefty health scare
Yeah.
a couple years ago. How did your spiritual care training personally help you at that time? Where oftentimes, like, I'll tell you an instance, right? Where when I was at the Vedanta course, we had a brahmachari who had a sister that needed an organ transplant. So he's talking to his mom. Mom is worried about the finances of this. There was no father at home, so all these things they're worried about. And he says, "Don't worry, Ma. Bhagavan is there." And the mom says, "That's works for you in your ashram. This is the real world." So when this knowledge is there about the spiritual care and everything, when it personally has to kick in, what was that whole thing like?
That is, during that time, um, I've I remember everything vividly. Um, and I saw my husband like literally flatline on the EEG, ECG in my front of my eyes. And I thought that only thing I can do right now is pray. I don't know, that kicked in, right? Probably part of it was shock also, but at the same time, I thought only thing I can do is pray right now, because I was with the doctor, like the nurse and doctors were there, the paramedics were there, everybody was there. They were doing their job. There was nothing I could do. Wailing and screaming would not help. So I chanted Mahamrutyunjaya mantra.
Mm-hmm.
And then I said, okay, I need to talk to somebody about this, because I was alone at the hospital for, I don't know, time passed. I was there. And then I called Swami Shivatmananda ji, because he was my Bhagavad Gita, like he was the spiritual care course teacher.
Mm-hmm.
And I called Swamiji, but Swamiji didn't pick up because I was calling through Swami Sarveshananji. He didn't pick up because I was calling through Signal, but then he called me back immediately because I then wrote him a text. And Swami Shivatmananda ji was on plane, so he couldn't talk. But he said, you do whatever gives you peace of like calmness. And Swamiji, so I did seek care, right? Like I reached out to the folks that I know I have to reach out to. I reached out to Binduji, who was a chaplain, and she was, I think at that time she was doing CPE first unit at Children's. So I reached out to her. So those were the three people I reached out first.
Mm-hmm.
And that is also grace of God that I thought about those three people.
Right.
Because I said, I'm not going to call my other friends and my sister right now, because then I would be just talking about and I won't get time to pray. So for me, I think Chinmaya Mission, all the teachings of Swamiji, like everything kicked in. And I knew prayer was the only thing I could do at that point. And there were possibilities, because the doctors were not giving me any confidence at that point, like 2 hours after the incident. They were not. We got reassurance to some extent only on the third day. So till then, I was chanting, and I prepared myself. And I said, Anand is not. I would Tattva Bodha, right? I'm thinking about Tattva Bodha, that nobody ever dies. Like we are immortal, divine being. Like our true nature is immortal. So all those things I think kind of helped me. All that scriptural knowledge,
Which never would have come to mind if not for some kind of
yeah.
program
Otherwise,
like
I would be
this.
caught up in my mind,
Right.
and I would not stand there as a witness to all the things that were going on. So that's what I did. Now, I don't know if I did that out of shock or I did that out of knowledge. I can't say right now, but that's how you saw me. I was
Yeah,
smiling
yeah.
and talking
Which was unusual to
peacefully.
me when I came and visited in the hospital. I'm bracing myself for the worst and seeing Ananji there. I'm also feeling like, man, what's going
Yeah.
on? And you were calm. You were like cracking jokes with me a little bit too. And I was like, wow, this is different.
Yeah, I don't know. I mean, now when I think of it, I cannot imagine what's going to happen if it happens again. I do feel scared a little bit sometimes.
Yeah.
Um, but yes, that time I don't know where the strength came from. It's God and Guru's grace. I would just attribute everything to that. There's nothing my doing.
And that's the thing. The knowledge has to come from within to the person at that time. Because
Right.
what we're also told as brahmacharins is if someone's going through a grieving process, just losing someone, that's not the time to go in with Bhagavad Gita knowledge of, Atma
Mm.
persists, Sharira is just a sheet. You go in with that, that's not the right way. Or
Right.
conversely, someone has a baby. You go and you meet them and they say, who does the baby look like? You say either mom or dad, and then you get on with the day. You don't start with, because this baby did not exhaust vasanas in a previous life, born
No,
as this hunk of blood and mom, son, flesh and
exactly.
everything. It's not the right time for that. Knowledge
Definitely.
has its place. That time of when they're grieving and shock is not the place for it.
Exactly. So, yeah, so we would never bring that up, even with Hindu patients.
Mm-hmm.
I would sometimes I would ask them, like, who's your favorite deity?
Mm-hmm.
Like, if it's a Hindu patient, I will say, who's your Ishta Devata?
Mm-hmm.
And I would say, like, I would start my prayer with, oh Lord Shiva or Lord Hanuman. Usually, if it's
Would a
kids,
lot of them have Ishtadevatas, the patients that you
I
saw?
would say, who's your favorite Devata?
Okay.
If it's if they don't know what is Ishta Devata, then I'll say, who's your favorite god
Right.
to the kids?
Mm-hmm.
And most of the time they'll pick Hanumanji, right? So then you could chant a Hanuman Chalisa if you wanted to, or just when we say the prayer at the end of our visit, I would say, dear Lord Hanumanji,
Mm.
you know, I pray to you to bless him with health, and I pray to you to bless the doctors and the nurses who are taking care of him or her, so on and so forth. May he get healthy soon and, live to his full potential and serve his family, his community. That's my way of praying. Like, I want the highest for the child. So that naturally comes out of me. Like, may he live to be a, healthy, young, grow up to be a healthy young man or a woman who's able to serve her family, society, community, country, and maybe the whole world.
So how do you make these prayers and talk to them when you know they're terminally ill? You know there is a timeline.
Yeah,
What
so
do you do
you
then?
would tailor it a little differently, right? You would say, give them the strength and the courage to face the challenges that you have given to them,
Do
Tom.
these kids know that they're pretty much at the end of their life?
I have met couple of them who were like really little,
Uh-huh.
so I don't think they knew.
But are there kids that you work with that they know, and how do they react?
Mm, I have not. Well, I did meet one girl, but I didn't get to do spiritual care
Mm-hmm.
with her. Um, but I have not met cancer patient. I did do a dissident care
Mm-hmm.
for the surviving family,
Mm.
and because they were receiving spiritual care throughout the child's chemo and all the treatment, they were doing amazingly good. I
Yeah.
mean, they were crying, but they were also taking care of the business. That whole thing.
Mm-hmm.
It was it was inspiring to some extent because they were holding it with grace,
Yeah.
but because they knew that actually many times when they know, it's possibly easier, but the ones that pass away in ED, those are very tough
Mm.
because sometimes they are coming for like tonsils and then passing away
Really?
because of something else, not because of the tonsil surgery, but
Uh-huh.
something else.
Some pre-existing condition.
Something, yeah, and
Yeah.
those are shocking, right? Those are difficult.
Yeah.
But I mean, so we usually let them grieve, right? Whatever they want to share and echo and and some, for some reason, it does help. It does help them. Just keeping quiet helps a lot. It's mostly we are listening and letting them, and sometimes even if they don't talk and you are just listening, even that helps. But it is very tough when somebody has a term, like it is hard for the parents for sure. But I think if they are going through this illness and if they have proper care, um, it's just prayer to God that they have the strength and courage to face the challenges that they are facing. That's all we can pray.
So in this line of work, even in this line of work, there's a sense of personal satisfaction from a job well done, or you're growing in your capabilities as a spiritual care provider. What are those markers you look for? That, okay, I've spoken to a patient. Is it a certain reaction from them, or is it that, okay, I went through the points I wanted to go through with them? What is it you look for to say, okay, this was a good interaction I had versus I could do better in these kinds of areas? What is your checklist, so to speak?
Yeah, so that comes about when we do our verbatim and we present to the whole group.
Okay.
That time they, oh, those are brutal.
So it's like a peanut, everyone else kind of pitches
Comments
in on how
on,
you did.
yeah,
Okay.
yeah.
Wow.
So brutal, but in a nice way, because that's when we realize why we behaved in this way, why we did not talk about this.
Mm-hmm.
The patient gave you an opening, why you did not go through that.
What's an example?
Example, I had this patient who had eating disorder, and the family was going through a lot. Both, mom was heartbroken, and she, so I did the holy listening stone because it was a young girl. And she picked something and she kind of murmured. I could barely hear her. And then, so whoever is in the room, we will do it with them. Like, we don't just do it with the child.
So family members or
Family
friends?
member, or sometimes there is this officer, not officer, what is it called? Like, some rooms, there will be always the presence of a nurse or a technician.
Okay.
Is there because of the condition.
Right.
So everybody we can engage, a chaplain can engage everybody. So mom picked up a broken heart, and then she was saying my heart is broken and crying, and sharing some things about the financial situation. And I should have talked about, like, okay, tell me more about this, or tell me about your tears. But I didn't, because the daughter held the hand of mom. So I felt like she doesn't want her mom to cry. Should I make the mom cry more? Right? That was my hesitation, my personal bias. So, like, we talk about personal biases. So I'm positive outlook most of the time.
Because you're looking for the comfort of the kid, not the catharsis of the mom. That
Exactly.
has to happen. Okay.
So you don't want to be a nice chaplain. You want to be a good chaplain. A good chaplain doesn't have to be nice.
Okay.
Remember Swamiji, he can yell at you, but it is out of love. It is for your own benefit, right? All of Mahatmas or our gurus, they are not necessarily always like pleasant.
There's no growth if they're always pleasant.
Exactly. And that's for a reason. But it's out of kindness, and it's out of caring. Similarly, a good chaplain doesn't mean that he, like, will not hesitate to poke a little bit for healing purpose, for the benefit of that person. But because we are so much like we have our own growing to do, right? So sometimes we will avoid. Sometimes we'll do good. It's not like always, but sometimes we'll hesitate. And when we hesitate, then why we hesitated. So that means you go in your own story. Why did you want to do, why you did not? So that's a lot. So that's a lot of very rigorous training. And that 4 units will kind of make you so good, so confident in your ability to heal others. Because ability to heal others or being a good chaplain is there. That is why you actually took up. Because that genuine interest of wanting to help people is there in any person who takes up spiritual care. And that's what my instructor told me, like, why are you stuck in your own past and all? Like, you already have the skills that you need.
Right.
It's just acknowledging, understanding, grieving, and lamenting your narrative history and healing yourself so that you are not hung up with your own barriers, so to see, mind barriers. Yeah.
So finally, 10 years from now, what are your goals that this is what I want to achieve through chaplaincy work, or this is what I want the field to look like through my work? What are you looking for down the future?
I think that we definitely need chaplaincy instructor, CP instructor, who are informed by Hinduism, right? Because we don't have any teachers who are informed by Hinduism. Like the instructors are all good. I mean, the true instructors who follow the ethics and code, they are not biased against any religion. But still, I remember my instructor said, because I said one time, we ask sometimes, what do you want me to pray? And if the person says, pray that I get a prize in this competition, like a child says that, right? Then you pray for that. And then, so in my one-on-one, so we also have one-on-one with the instructor, I said, should we really pray for that? Because what if it doesn't happen?
They lose their conviction that
Correct.
I prayed and it didn't happen.
Right.
Yeah.
So then what he said, which probably is okay, he said that how do you know that? And not all prayers are answered. It's okay if it doesn't get answered. That's fine. But you can pray. Like, there is no harm in praying for materialistic items if that's what the patient tells you to. But not necessarily all prayers are answered. So, okay. And you don't know because you are divine, but you are not God. And I am like, I am not this body and mind, but I am,
Right. Right.
So they would never accept that, we are nothing other than Parabrahman, right? That probably is missing. And they would not accept this explanation of that Ishvara remaining when my ego, for even momentarily, when I'm in that non-judgmental phase,
Right.
My ego has dissolved for that moment when I'm in that space providing care, but the Ishvara is acting. So all this is happening is through Prakriti, and it's not me who is doing anything. So in that sense, like, I couldn't care if my visit was not great. Like,
True.
we have to say, what do I want to learn from this visit? And most of the time, like, I don't know. If you want to come in my mind, I will make up something. But to be honest with you, I'm like,
It doesn't always come.
this is what it happened. It happened, meant to happen like this. Sure, I learned few things that I have to notice what is the pain point and then push on it. Like, all those skills I did get through this action, reflection, action, new action.
No amount of instruction can prep you for it.
Exactly.
Only through trial and error
And
does it get sharpened.
I feel it's your own sadhana.
Yeah.
Because through sadhana, we exhaust our vasanas too, right? Like through meditation, japa. So that also helps with providing care in this, that your presence could itself be enough for the person to want to share with you.
Right. Right.
So I give more importance to sadhana, whereas in the Christian world, they give more importance, because I know that through sadhana also I will heal.
Mm.
Whatever I have, my barriers will heal through sadhana as well.
Mm-hmm.
Whereas they think that you can heal only through lamentation and grieving, which is true for the patient in the hospital setting, or kids or teenagers, yes, but not necessary that is the only way. Because our Mahatmas, through all these satsangs that we have heard, there are other ways to heal also.
So thank you so much for talking to me, Sonali ji. Really eye-opening on what this field is, and the main reason why I wanted to have you on is to spread awareness for this, that it is a need. As our population increases in areas, it's that people will pass away here, people will have illnesses here, and that Hindu support has to be there in these moments when we're at our lowest sometimes. So really
Right.
important work. And anything you'd like to add at the end here?
I would say I'm there for our congregation. If they need, it, I would be happy for one-on-ones with anyone.
Mm-hmm.
That's given. And I encourage young people who are inclined spiritually to actually take up CPE and even do extended CPE 4 units. They can get an equivalency if they have done, satsang, like attended satsangs or any of Vedanta YUP courses or any of those, right? All those can count towards
As equivalency credits.
Equivalency credits.
Okay.
They can get equivalency credits and do this. Get certification. Then even if they don't want to do it full time, that's fine. I encourage everybody, like people who are spiritually inclined, to do CP, because we are in need. And I definitely want awareness for everybody, not just kids, teenagers, college kids, but moms, dads, to seek help and just let somebody, because I know we went with our friends, right? But that's really not helpful. It is helpful when you are talking to a chaplain or a Swamiji, then it is helpful. But if we are just venting with our friends, it's actually not really helpful. Because a chaplain will know not to promote certain things.
Right.
And so I would encourage people to seek help. And we have quite a few people now in the Metroplex who have done some coursework in chaplaincy. So seek those folks out.
Wonderful.
It's the need. Yeah.
Thank you so much.
You're welcome.